We are now pleased to present the Innovation in Vaccine Services Award, sponsored by GSK. This was the first year of this award, and we were very pleased to receive over 20 applications. The applicants were asked to write an essay on how they contributed to vaccine services beyond just flu and COVID-19, but include privately funded vaccines. Included in the essay was why it was important to become a leading provider in their community, how they integrated immunizations in their workflow, and evidence of the positive difference that they made and their vision for the future. You will be able to read the full essay in the Canadian Foundation's Pharmacy, Changing Face of Pharmacy magazine, which will be coming out at the end of November. And if you don't get a physical copy in Pharmacy Practice, you'll be able to download it from our website. I would like to thank our review committee of CFP board members, Rita Wynn, Shalita Datani, and Matt Chachek from RXA, and Roz Stefanek, who is one of our writers, for the time and effort to review all these submissions. I'm also pleased to announce that we have received confirmation that this award will be continuing on next year to the generosity of GSK. I would like to ask Raymond Guber, who is a CFP board member, but in his full-time job, works for GSK as Head of Pharmacy and Clinical Practice Innovation. Raymond?
I was going to say, I don't need the clapping. It's for... So initially, I was going to hope that that picture wasn't up there because I was going to make people guess at who won this award. So let's pretend that that's not there. Don't throw me off. So our winner this year has been providing immunizations and clinical education since 2012. As a community pharmacist, he's an accessible provider of immunizations to patients in the community. In 2018, he started an organization called Immunize.io with a mission statement of taking our best shot at immunizing the world. Through Immunize.io, he's worked with numerous organizations and communities to address vaccine hesitancy and improve vaccine access locally, nationally, and globally. He champions community pharmacists as leaders of immunization services, as we should be, and presents on this topic at both the national and global level. He's a clinical assistant professor for the University of British Columbia Faculty of Science program, and also helped coordinate an elective course for the UBC Pharmacy program in travel health and immunization. I had the pleasure of being a faculty at U of T while Ajit was a student, and I never actually taught him directly, but I like to tell myself there was some level of osmosis there. So congratulations to our winner this year, who's demonstrated an unwavering support to immunization. Congratulations, Ajit. And he unfortunately couldn't be with us today. You'll understand why in a moment, but please put your hands together and congratulate Ajit.
The Canadian Foundation of Pharmacy for awarding Immunize.io the Innovation in Vaccines Award for 2024. My name is Ajit Johal. I'm a pharmacist, clinical director, and co-founder of Immunize.io, and it's with tremendous pleasure and pride that I accept this award on behalf of the organization. I would love to be there in person to accept this award in Toronto, but there have been some new additions to my family, so I can't make the trip. Since graduating as a pharmacist in 2012, I ran the first influenza vaccination clinic at my dad's pharmacy and immediately became very interested in the topic of immunizations. Since then, I've expanded the vaccinations I administer to travel immunizations, routine immunizations, as well as recommended vaccines that are often not funded as part of public programs. In 2018, myself and pharmacist colleague Mark Zhao started a not-for-profit organization called Immunize.io. And our mission statement was taking our best shot at immunizing the world. And where we got that mission statement was actually from Tom's Shoes. Now, I know nobody wears Tom's shoes anymore, but when I was in pharmacy school, they were very, very popular. So with Tom's shoes, it was a social impact mission statement where when you bought a pair of shoes, there was a pair of shoes that was donated to children in developing countries. And we thought that the idea of every vaccine we provide protected people here, and we would do a one-for-one. So every vaccine we administer here, we would donate to developing countries. And that donation has taken different forms. We've done monetary donations to UNICEF and Polio Now. And recently in October of 2023, our donation consisted of donating cold chain technology to Nigeria for their inaugural HPV vaccination campaign to support access of HPV vaccine, maintaining the cold chain to hard-to-reach areas. Similar to the cold chain technology that we use in our clinics pictured here. We've really embraced vaccination and providing convenient access to immunization to residents of BC through community pharmacies, Schedule II immunization, as well as providing off-site clinics to employers administering vaccines like herpes zoster, pneumococcal, RSV, HPV, as well as MMR, tetanus diphtheria, hepatitis A, hepatitis B, almost 4,000 immunization, 100% pharmacist initiated. So we initiate our own orders, we take ownership of assessing patients, providing them access to vaccines, and coordinating follow-up if they need to complete the series. I think a lot of the lessons we've learned, all the case studies, all of the publications we've done in various conferences about the work we do to support vaccine access can be translated into sustaining primary care. This award comes with a cash prize of $2,000. We will be donating that to support a science competition and future generations of vaccine education and prevention against disease for developing countries. Thank you again for this award. It's truly an honor, and we hope to inspire future applications from pharmacists to innovate in the vaccine space. Thank you very much, and enjoy your evening.